Ever feel like you are just memorizing facts, only to forget them quickly when the exam arrives? What if there was a powerful way to truly understand and remember complex medical concepts, not just for the next test, but for your entire career? The most effective way to use elaborative interrogation for medical school involves actively asking and answering why and how questions about new information. This powerful active learning strategy helps you build deeper connections between concepts, leading to significantly better long-term retention and understanding. This technique is rooted in cognitive psychology, specifically how our brains process and store information. When you intentionally ask why a particular medical phenomenon occurs or how a treatment works, your brain is prompted to actively search for explanations. This process, known as elaboration, links new facts to your existing knowledge base, creating a richer and more interconnected memory network that is easier to recall and apply. So, how can you put this into practice every day? First, identify a specific medical fact or concept you are trying to learn. For example, you might start with something like, hypertension is defined as chronically elevated blood pressure. Next, immediately ask yourself why questions about that concept. You could ask, why does hypertension lead to an increased risk of heart disease? Or why is a particular class of medication like ACE inhibitors prescribed for hypertension? The crucial step is then to answer these questions in your own words, explaining the underlying mechanisms. Try to connect this new information to anything you have learned previously. Think about questions such as, how does this relate to the renin-angiotensin-aldosterone system we studied last semester? Or, what are the physiological consequences of sustained high blood pressure? Even better, try to apply it to clinical scenarios. Ask yourself, why would a patient with diabetes be at a higher risk of kidney damage as a result of uncontrolled hypertension? Make sure to practice this regularly, integrating it into your daily study routine rather than just cramming before exams. This approach moves you beyond simple rote memorization, which is absolutely vital for developing robust clinical reasoning skills in medicine. It helps you build mental frameworks, or schemas, for complex medical knowledge. These schemas allow you to retrieve and apply information flexibly in various clinical contexts, making you a more effective future physician. Educational research consistently highlights elaborative interrogation as one of the most potent active learning strategies available to students. By actively questioning and thoroughly explaining the medical concepts you encounter, you are not just memorizing. You are transforming surface-level recall into a profound and lasting understanding. This strategy will not only improve your performance on medical school examinations, but will also lay an incredibly strong foundation for the critical thinking and diagnostic acumen essential for providing excellent patient care throughout your entire career.